doctor team and I, Dr. Ferguson, have been tasked to find out what has been causing three people to die in the last 3 months. The first was a 5-year-old girl, the second was a 7-month pregnant woman who was 42, and the last was a 17-year-old boy, and they all had died with similar symptoms. All three people were healthy, and there was nothing that was perceived to be wrong with them until a week before they had died when the symptoms started. The first person to die was the girl, and she experienced symptoms that include involuntary muscle movement, reoccurring seizures, projectile vomiting, and the girl was very dehydrated due to her lack of water intake. The second patient was the pregnant woman. Her symptoms included seizures, muscle mass loss, dehydration, chest pain, and muscle cramps. The last patient's symptoms included seizures, dehydration, muscle spasms, chest pain, fatigue, and muscle cramps. The girl was pronounced dead with no cause of death. The other two patients were pronounced dead with liver failure and kidney failures. All of these deaths have been asked to take a second look at by us, and we have found a little background information. 2 weeks before the death, the pregnant woman and the 17-year-old boy ate at Super Sam's soup shop. One ate carrot soup and one ate miso soup. Even though this might not be connected, it's the only similarities we have found in our research. These patients eating here were not the cause of their death, and the only similarities we could find were their symptoms. We will have to perform autopsies to get a better look and to find more of what could have caused these deaths.
Dr. Ferguson and myself were tasked with performing an autopsy because the families and friends of the victims all thought that the original autopsy reports were kind of fishy. So the three bodies all went through separate and thorough autopsies with the greatest care. Throughout the autopsies, we found many things, but what surprised Dr. Ferguson and myself was that these three deaths were very much linked to each other. When this was first brought to us, we were extremely skeptical about this, but after our work had been finished, we discovered that the big thing that linked them was creatine deficiency syndrome. During the autopsy, we noticed that the body of the 5-year-old child had an abnormally small head. Another thing we noticed in this baby was that there was very little to almost no creatine found in the brain of the 5-year-old child. We decided to run through the medical records of the child that the hospitals kept and saw that she had already been diagnosed with having delayed speech development. When looking at the muscles of the child, we also noticed that there was little to no creatine in her muscles, and this was one of our indications that the creatine found almost nowhere in the muscles and the brains might have been the cause of death. Dr. Ferguson and I then went on to the 17-year-old boy, and he also had very little creatine in his brain and muscles. His organs were also severely affected, including his kidney. The original autopsy of this boy said that the cause of death was kidney failure. However, this is wrong. When looking at the kidney, there was no toxin buildup or any other sign that would indicate to kidney failure. But instead, very little creatine was found, and so the energies level in the kidney were low, and so that's why the original autopsy report labeled it as kidney failure. We decided to also get the medical records of the boy, which the hospitals kept, and ran a test on his blood as well. The records showed that he had delayed motor skills and had ADHD. The boy's blood test also revealed that he had very little creatine in his blood, the average being between 0.6 and 1.2 milligrams per deciliter for men, while he only had 0.2 milligrams per deciliter. The next victim was a 42-year-old woman. Once again, during the autopsy, we found that her muscle mass had decreased significantly from what was considered to be healthy, and that she had very little creatine in her muscles, which would contribute to this muscle loss. There was also very little creatine in her brain. So this woman was said to have died from liver failure. However, this is not true. Her liver was affected by not having a lot of creatine in it. This would affect her liver because it needs a lot of energy to work. So without the creatine being transferred there, the liver and other organs throughout her body suffered greatly. When looking at her liver, she also had a very or sorry, I should correct myself. While we continued the autopsy, we also noticed that she had a very sunken part in the middle of her face. We looked at her past records and found that she was said to have abnormal heart rates as well. So this was also very interesting. So, interested in what we found, we asked both the girl and the woman's fathers to be tested. We tested, or we went through the woman and the father's records instead of being tested, I'm sorry. In their records, both the fathers were positive for creatine deficiency syndrome, and we realized that both of those fathers passed these on to both of their own daughters. And when these daughters were born, the hospital mislooked over this fact and just never announced that they had this, instead giving them diagnosis on smaller issues, like the baby girl or the 5-year-old girl having motor skill problems. And since the 17-year-old boy had very similar symptoms and autopsy reports, we looked very carefully at all the issues, and we came to the conclusion that the three of them had creatine deficiency syndrome.
Due to this autopsy report that we have completed, the explanation for the death is creatine deficiency syndrome, because of the effects it has on the cells inside the patients. Our findings noted that the boy's blood test revealed that he had very little creatine in his blood. He averaged between 0.6 and 1.2 milligrams for men, while he had a shocking 0.2 milligrams in his blood. This was also proven for the other two patients, as well as them having well below the average creatine levels. Due to this, their bodies were not able to produce enough ATP for their bodies to survive. A disease like this affects the big tissues in the body, like the heart, the kidneys, and the livers. Due to these patients having this disease, the transponder proteins have been affected in their bodies because they cannot bring the creatine to the cells. This disease is caused by a change or a mutation in the creatine transponder gene, which is the SLC6A8 gene. This mutation results in a blockage in the transportation of creatine to the brain and the muscles. This disease affects the NADH in the body because the transponder chain is unable to give the electrons down the chain. This caused an extremely high amount of NAD+ to be inside the cells with the inability to turn into NADH. The glucose and pyruvate numbers were normal in the cells, so we have diagnosed the creatine deficiency syndrome, and that is why the other two causes of death that were originally stated were kidney and liver failures, because that is where it affected those patients.
Creatine is an amino acid found in the body's muscles, brains, and can also be found in the liver, pancreas, and kidney. Although found naturally in the body, creatine can also be found in red meat and seafood, and there are now supplements for creatine. So creatine deficiency syndrome cannot be treated through can be treated through what is known as oral creatine. This helps the brain, which needs creatine, and it can also help with many other brain disorders. For another type of creatine deficiency syndrome, there is no cure, however. There is very little treatment actually for creatine deficiency syndrome. And so, high-dose L-arginine and L-glycine supplementation so far has not consistently improved clinical or biochemical outcome in males. Although, some have reported to have increased muscle mass and improved motor and personal social skills. So hopefully this stuff gets better as time goes on. One female also, so she had intractable epilepsy, epilepsy responded to high-dose L-arginine and L-glycine supplementation with cessation of seizures. With this female, right, she had seizures because she had low creatine levels, and so these supplementations, according to her, helped her with this. And so now I'm going to talk about the role of creatine. So the role of creatine in the body is a very important one. As mentioned before, it helps provide energy to muscles, organs, and the brain. All three of these victims unfortunately had creatine deficiency syndrome, and so these areas were all affected. The brain could not function properly in all three. It had very low creatine levels, hence why a lot of them had seizures. The muscle mass deteriorated because there was no creatine being transported to the muscle anymore. And because of this, they all had low energy. So the victims became tired very quickly. In the case of the 17-year-old boy and the 42-year-old woman, we saw two organs specifically get hit the hardest, basically. And in the 17-year-old boy, this was the kidney. And this kidney didn't have enough energy to continue doing what it's supposed to do. And so, along with all the other issues that came with creatine deficiency syndrome, he was hurt. Same thing happened with the 42-year-old woman whose liver was affected by low creatine levels.